Radio Vision Network. I am Mark Cook, and we have another awesome Tuesday for you because I am joined by the one, the only, Robert Sierra from Ivy Rehab. Robert, how are you this morning?
I'm doing well. How are you?
I'm doing well, thank you. So, you're back. So first things first, Ivy Rehab, located on Route 130
Correct.
in Cinnaminson, right on that track there behind the Walmart, right?
Got it.
See, I was really trying to do something special with Robert today, and that was a test of my memory, and so far I'm scoring 100% on this test, right? You're impressed, I can tell.
I am. Do you remember the street address?
Really now, you're really pushing it, Robert. Come on. I got the town, I got what road it's off of, I got the nearest major landmark, and the address is?
2200 Wallace Boulevard.
All right, so Ivy Rehab is a great place if you have any needs, any rehabilitation needs. So, you know, one of the things we wanted to talk about this morning were your joints and replacing those joints. We've talked, you know, in the past we've talked a little bit about the knee replacement, we've talked about the hip replacement. One of the things that they're starting to do now that's a little bit becoming more common is the shoulder replacement, which was never done in the past.
Right. So
let's steer this in a direction rather than just talking generally about knee replacements and hip replacements. So one of the things that I am just kind of learning about is that the parts that you're born with are better than the parts that they replace your parts with, right? So this knee that I have here that's not been replaced is stronger and better than anything that they could put in here.
So what would we come with? Yeah, our original equipment seems to last longer. As much as they try to develop new alloys and new materials to go inside of the knee, they still have not quite mastered some of the kinematics or how the knee really moves. And because of that, typically a knee replacement, depending on your activity level, lasts about 15 years versus the one you came with usually lasts 55, 60.
Right.
Yeah.
Yeah, so to me that doesn't really make a lot of sense because in 2016, all of this technology that we have, right? We send things up into space. We've got all of this great composite material, and we, like you said, the alloys and all this stuff. It's resistant to heat. It's resistant to cold. It's got, you know, the technology is out there. The plastics, all this stuff, but yet your human stuff is better than the stuff that they are, you know, building to replace your parts with. Now, with that said, the technology is still moving in a direction where they're working really hard and researching and trying to strengthen some of these things because
it's constantly changing.
Right, because what you said is that right now, a typical knee replacement will last about 15 years. Say you're a really active person and you need one around 50 years old. Well, at 65, you're going to need another one, right?
Potentially.
That's pretty much the scenario, depending on your activity levels, and that's, you know, that's really the basis for anything on how it's going to last and how it's going to work and all that stuff is going to be based on your activity level. But how soon are we going to get that 30-year knee replacement? Or, you know, is that something that's just not even on the horizon yet?
I think they're still working towards it. You know, they're still developing new and different knees. There's all different kinds of brands or, you know, models of knees. You know, they're being fit specifically to people to try to make it more similar to what you came with.
Right.
You know, they're trying to work towards it, but it's stuff you came with is still so far lasts longer.
And what you mentioned before about the knee, and a lot of people don't realize, like they just think that it's just this hinge that moves back and forth and all of that, but there's so much more going on in your knee that you wouldn't necessarily think about, and that's what makes it really hard to replicate because of the way that it moves. Now, talk specifically about some of the ways that the knee moves. You talked about these 5% movements that are so small and not necessarily noticeable to the person, but are huge impact on what's happening in the inside of your knee there.
Yeah, correct. You know, most people think your knee just it extends to go straight and then it bends to go backwards, and that's it. There's a lot more to it than that. You know, as the knee extends, the lower half of your leg, you know, from the knee down to your foot, has a slight rotation to it. And it rotates one way when you extend it, and it rotates the other way when you bend it. And that rotation adds a complication to the knee because it's not a simple, like a door hinge.
Right.
Then to put on top of that, you have your kneecap. Your kneecap technically articulates with the under part of your knee, so that adds another complication to it because that's another piece that's free-floating and moving and interacting with the knee as it bends and as it straightens. So you add all those components in, and the knee becomes a really surprisingly complicated unit.
Right.
And to make things even more complicated, without you having any weight on it, your knee moves one way. When you stand on it and you say you get up out of a chair, you stand or you squat, it moves a different way. So it actually shifts and rotates and glides in a different way, whether there's weight through it or not.
Right. Okay. So what is that? Like is it a tension? Is it a impact thing, or is it just it's all the different movements and how they basically impact what's happening underneath the cap, right?
Part of it, yeah, and part of it is just the tension within all the ligaments and the muscles, and when you're standing, everything is held a little bit more taut, so it moves differently versus when there's no weight through it. It's a little more, it's not as compressed, so it's a little more free-floating, so it glides and moves around a little bit differently.
Okay. So we got to take a quick break. When we come back, I want to talk about things that people can do to strengthen their knees and their joints to, maybe avoid that knee replacement, and some of the ways that they can, stay active. Maybe some people out there have just had one and they're looking for some exercises or something. So we'll get into that too. So we are going to take a quick break on Morning Coffee. So stick around and we'll be right back.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facial, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at alicia@whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
On the Radio Vision Network, and we're here with Robert Sierra from Ivy Rehab. Now, Robert, we were just talking a little bit a while ago about knee replacements and all that happy stuff. Now, you actually, during the break, you were just telling me something that I think is really interesting, and that's the process and kind of the time that people are going to be laid up when they have knee replacements. Now, the old scenario was, well, I got to go to the hospital and get the surgery, right? Surgery takes all day. Then I'm in the hospital for 3 days. They discharge me from the hospital. They move me to a rehab facility. I'm there for 10 days to 14 days or whatever it is. Then from the rehab facility, they send me home, and then I have all these appointments and stuff to do after that to make sure everything is, working right.
The process is long. I mean, the old model that a lot of surgeons function under, and actually some of them still do, is you'd have surgery. Surgery takes about an hour itself, which is kind of crazy if you think about that.
Right.
And then
super fast.
It is.
Yeah.
And then you would be in the hospital for roughly about 3 days. After that, you're discharged to a rehab facility. You're in a rehab facility for like 10 days or so, and then you're discharged to home, and then you have home PT.
Right.
And then after several weeks of home PT, then you finally get to the point that you meet someone like me in an outpatient office, and then we work on the nitty-gritty stuff and get you back to 100%. The new model now is that, and a lot of surgeons are starting to switch to this, is you have a surgery, same time frame, takes about an hour. You're only in hospital for about a day. They discharge you directly to your house, barring that there's any other medical complications.
Right.
If there are, then you might need to go to rehab still. But provided everything's good, you go home. You do not get home PT. They're recommended that you make an appointment immediately with
Ivy Rehab.
immediately with Ivy Rehab, and then you come into an outpatient therapist, and then we start addressing you right away.
So the process is so much faster now
Much faster.
than it used to be.
You know, the old model, most people didn't get to that point that they felt like life made sense again until about 12 to 14 weeks.
That's a long time.
Yeah, it's 3 months.
Yeah.
Where now, things have accelerated to the point that now it's about half that. It's about 4 to 6 weeks where things really start to feel a lot better.
Yeah, it was funny because I know a gentleman, he's in his, and he had his knee replaced. And now I don't see or talk to him every day, but it seemed like in 2 days, he was skiing again.
Yeah.
And the pictures on Facebook were him out there skiing with his family and living his life, you know, as normal as possible. Now, I'm exaggerating. I know it was longer than 2 days, but it seemed that fast.
It was quick.
Because I'm not with him every day, obviously.
Yeah, some people, actually, with that exaggeration, really are like 2 weeks or 1 week.
Yeah, I mean,
I mean, they're the outliers, but they do happen.
so that's where the technology is really coming into play. So, okay, the technology isn't there exactly with the building of the actual joint and the replacement joint. But there is technology in medicine and advances and all that that allow us to be able to do things that quickly.
Yeah.
I mean, the process back in the day was that long because it had to be that long because we didn't know enough about, I guess, what they were doing to do it in any shorter amount of time. This is how long it takes. We need to make sure that you're healing right and all this stuff. But with the advances in medicine and medical technology, that's where we're seeing a decrease in the time, in the time being laid up.
Right, exactly. I mean, even the process of how they're actually doing the knee. Of course, the surgeon can give you more detailed information, but just the way in which they do it has changed. You know, in the past, they used to cut a lot more of the tendon. Now there's a lot less of the tendon being cut. So rather than the tendon being sliced, they're just kind of moving the kneecap more to the side rather than actually cutting it.
And that's the big thing, right? The cutting of the tendon. I feel like I hear that all the time. And when the
That's
guys,
a big buzzword these days.
yeah, well,
Yeah.
when they're like successful, the guy's like, oh, like, he barely had to cut the tendon. So it's like, is that like a determining factor on how impactful your like rehab will be? Is it how much of the tendon they have to cut?
It impacts you afterwards. You know, the more that's cut, the less strength you'll have in the leg, the more pain you'll have, so it takes rehab that much longer.
Okay.
And if you cut a lot of the tendon, from a rehab standpoint, you have to be careful with how aggressively you bend the leg, because the tendon's been compromised because it's been cut, so you can't just, you know,
Right.
grip it and rip it kind of thing. You
Right,
have to,
right.
you have to kind of caress it into bending.
Right.
Where when less of the tendon's cut and it's more solid, it's more whole, you don't really have to worry so much with anything happening to it. It's just a matter of to the patient's tolerance of what they can do and what they can't do.
Right. It's kind of a neat thing because, you know, really what it does is, and really for anybody out there that's having knee pain or hip pain or whatever, go see your doctor. It's not, the process is not as daunting and terrible as it used to be. If you're worried about being in the hospital for weeks and having this long recovery process, it's not like that anymore. The sooner you go get your surgery, the sooner you can get to somebody like Robert and start getting yourself back to your day-to-day life without that pain that you're experiencing so intensely every day. So go talk to your doctor and start figuring out how you're going to get that knee replacement that you so desperately need. So let's turn it back to the Ivy Rehab side of things because that's what we care about and that's what we're here to talk about. So how many patients do you guys see on a weekly basis that have, replacements? Is this, primarily who you're seeing, or are you seeing different types of patients?
Not primarily, but it's a good percentage. I would probably say 30 to 40% of our patients have some kind of joint, either brand new post-surgical replacement or it's kind of a tune-up of an old replacement that needs a little TLC. But yeah, it's a big number.
Now, how much freedom do people have? Like, say there's somebody in a rehab facility right now. Or I'm sorry, they're not in a rehab facility, but they're going to a rehab place, and maybe they're not as happy with their results, or they feel like they should have more decreased pain, or they feel like they should have more range of motion, or something like that. Can they get out of that scenario and come and see you?
Patients can choose wherever they want to go. So, I mean, if they get a recommendation to come to us, I mean, they don't, need a prescription or anything along those lines, they can literally just show up and make an appointment.
Okay, great.
Yeah.
So I imagine that there's probably insurances and stuff that are involved with that, but
We take everything.
that's yeah, you guys take everything, and
Yeah.
it's not really an issue because
No, not at all.
you're still connected in the network, right?
That's right.
That's
right.
how it works. That's how you got to be, right? We're talking about rehab here. This is important stuff.
That's right.
But what that means is that you don't have to worry about your insurance coverage. Just go to Ivy Rehab. They take your insurance, pretty much, is what you're saying.
Yep.
That's
it.
awesome. So we got to take another quick break. We're going to come back. We're going to wrap it up with Robert Sierra from Ivy Rehab. Stick around on Morning Coffee. We'll be right back.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
Vision Network. I am Mark Cook. And we're wrapping things up here with Robert Sierra from Ivy Rehab. And we've been talking about knee replacements, mostly for the first 2 segments here. And what we kind of missed was what causes the knee replacement, and that's pain. Normally it's intense pain that people can't take anymore, that's built up over time. To finally they're like, I got to go to my doctor and get checked out here and figure out what's going on. But what most people don't understand is that they don't have to do it that way. Why don't you expound on that a little bit?
Well, I mean, when you first have knee pain, you don't necessarily have to run directly to a physician. You can come through us first. You can come into a rehab facility, come to Ivy Rehab, and we can kind of take a look at you and we can see what's going on. Sometimes the pain is truly in the joint, and it's just an arthritic type of thing, and if that's the case, then we can certainly refer you to a surgeon. But sometimes it can be coming from another source. You know, it could be a tight muscle, or it could be weakness, it could be all those kinds of things. And if that's the case, then we can certainly address that. And that might be enough to maybe buy you some more time so that you don't have to jump into the OR.
Yeah, I mean, and it's kind of a no-brainer to think like, all right, well, if I can try something else before I go have surgery and spend thousands and thousands of dollars, well, why don't I see if Ivy Rehab can maybe just help me manage my pain, and if there's something else causing it, they can help me.
Right.
But what's nice, and I'm sorry, I don't want to cut you off, but what's nice about it is that because you're a trained professional, you'll be able to identify right away, whoa, you better go to the surgeon. You're not gonna treat somebody with a major problem just for the sake of treating them, I guess is my point.
Right, exactly. You know, and if it is truly just weakness or a tight muscle, if that's the case, and, you know, we address all these things and they get stronger and they get more flexible, but that arthritic pain still hasn't gone away and they still end up having to go to a surgeon, end up getting a knee replaced anyway, all of the gains and the benefits that they made with us before will benefit them after. So it's kind of a win-win for the patient either way.
Right. So basically, we need to figure out a way to re-educate people and kind of break the old habits, because the old habit is, I guess maybe the first thing you would do is go to your family doc. Your family doc then sends you to the specialist, and the specialist then goes from there and then gets you in touch with the surgeon and all of that stuff and blah, 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 blah. What you're saying is, well, you don't necessarily need to do that. You can, once you're experiencing the pain, and whether it's arthritic pain or other types of pain or whatever, go to Ivy Rehab, talk to you, one of the people on your team, and we're going to figure out a way to help you manage your pain. And we'll identify, like you said, if it's just maybe a muscle pinch or something, or if you're going to need a full replacement. And what's cool about it is that I don't care what it costs, it's going to be more manageable than going and starting the process of the big healthcare machine, right?
Right.
I mean, I hate to say it that way, but
You know, if you really do look at the cost of care and you look at the money that the patient has to put out, physical therapy and that kind of conservative treatment is one of the cheapest routes.
right.
And oftentimes one of the most effective.
Right. I'm married to a physical therapist. I believe me, I understand the value of it. And what people don't understand is that, well, what I think what a lot of people think is a physical therapist, well, they're not doctors and they're not, they're not just the average person, but they're not doctors, so whatever. Well, what you don't understand is that physical therapists go through just as much, if not more, training than anybody else in the healthcare field, but it's specific in your body. They study more anatomy and more things about your body, and part of being a good physical therapist is continuing your education and what's changing and all that stuff. And I know that you do all that stuff over at Ivy Rehab.
We do. We're movement specialists. That's what we do. So if there is any kind of movement deficits, that's what we address. And if we come across anything that we feel needs to be, more medically addressed, whether it be like a knee replacement or whatever the case may be, that's when we refer out.
And what you're really gathering here is, or at least I hope you're gathering, is that it's care. They care about you, the patient. They care about where your pain is coming from, how they're going to help you with your pain. They're not going to try to keep you as a patient if you need other care. That's what he's saying to you, is that if you need a replacement, you're going to go get the replacement, but you can go stop and see Robert first and talk to somebody very nice and down to earth and just figure out maybe what your next steps would be. So right now, I want to send everybody to Ivy Rehab.
There you
So
go.
I want you to do your thing, and I want you to look into that camera right there and tell everybody how they can get in touch with you.
It's easy. It's Ivy Rehab in Cinnaminson. It's right off of Route 130, just behind the Sam's Club and Walmart. It's 2200 Wallace Boulevard, Suite E.
Perfect.
Yep.
Website?
IvyRehab.com.
That is a complicated website. IvyRehab.com. Go check it out. And stop over in Cinnaminson and see Robert Sierra. Rob, thank you so much.
Absolutely.
This was great this morning. Thank you. I
It was a
appreciate
pleasure.
it.
Thank you.
Nice. So we got to take a quick break, and we'll be right back on Morning Coffee.